Hi there everybody, this is the March team brief and I want to tell you a little bit about what's been going on for Leicestershire Partnership Trust and how it might impact on you locally. Firstly, we had our Quality Summit. This is what happens after you've had a CQC report, where all the partners get together to talk about the report and what we need to do to improve our services. It was very clear that we had a lot of support for the journey that we're on, and it's really important that we work really closely with our partners to ensure that we've got the right resources in the right place to manage all the patients and the demand that's coming through our front door. I know you're all really busy out there and it's really important that we get that bit right. Everybody was really complimentary about the caring part of the report. You on a regular basis show the care and compassion that is needed. We just need to ensure that we get all the capacity right going forward. Secondly, we've had the results back from the staff survey. Nearly 2,000 of you filled in the annual staff survey result, and that gives us a really clear impression of what's been going on in the Trust over the past year. Again, it shows that everybody's under a degree of pressure, and I understand that in our services that everybody's very busy. But it also shows some real improvements, especially in relation to our appraisals, both the quality of the appraisals and the number of appraisals that have been taking place. So thank you all for partaking in appraisals. Good appraisal conversations can really improve the way in which we work. Secondly, you've also felt that the Trust has been taking a real interest in your health and well-being. Last year we had the Global Corporate Challenge when over 900 of us took part in a Grand Step Challenge. This year we'll be doing the Leicestershire Round. Well, I hope many of you all put yourselves forward to come and help us complete a 100-mile walk around Leicestershire. Don't worry, you only need to do a little part of it each, and it'll be like a relay around many of the county towns of Leicestershire. So come and join me on that. And thirdly, you'd specifically noticed that the support for Agile Working and for being flexible has improved. We've had 30 teams now go through an approach to Agile Working, helping people access their information in a much more flexible way and not being so tied to a desk or a base, and that's really impacted on their productivity and their work-life balance, which has been really positive, and I'm really pleased with that. We want to roll that out. We want everybody that's able to adopt a more agile approach to do that, and I hope you'll put yourself forward in due course. Our board meeting was last week, and we spoke a lot about children's services, and in fact we had a group of school nurses come and talk to us who had gone agile, and they saw how the benefits of that and the services that they've been able to provide. It really was very heartening to hear of the progress that they've been making. Finally, we had a visit from an outstanding trust, the Northumberland Time Trust, came down to talk to us about how they had managed to transform their adult mental health acute care pathway. As we know, that's one of the most busiest parts of our trust, and at times we can't live within our means, which has meant that people have had to go out of county, and it's created waiting times in our community mental health teams and the pressures that has brought to bear on our inpatient services. In Northumberland Time they've adopted a transformational approach over many years, and now they've reduced their length of stay, they've had nobody out of county, and they've been able to manage the demand within their current capacity in their community mental health teams. We want to work much more closely with them in transforming our own services, and I hope you'll see the benefits of doing that over the months and years to come. Thank you very much for listening. Any questions, don't hesitate to contact me.